Hello everyone, my name is Christy May Talang, and today I'm going to do a return demonstration on a proper way of doing an immunization. Okay? So the first thing, of course, that we'll have to do in doing an immunization is for us to do an assessment. So in assessment, we obtain the patient's age and at the same time the weight of the patient, especially if they were born preterm. And at the same time, we go ahead and review the patient's immunization record. After we check the patient's immunization record, it is time for us to, of course, check the type of medication or vaccination that we are going to administer. Is it going to be live, attenuated, or inactivated? And then we make sure that we know the correct route of administration. After that, we go ahead and review any types or any contraindications or any precautions of the vaccination. So for example, we check for the patient's current health status, including any conditions of the immune. We also go ahead and check any medications that he or she has taken for the past 3 months, especially those that has caused immunosuppression. After that, we also check for any adverse effect or adverse events that has happened after the immunization. We also check for any types of allergies, especially substances that has caused an anaphylactic reaction. We check for the past history. We check if the patient is lactating. We also check for any receipt of blood transfusion, if they have taken any blood transfusion for the past year. We also check for any receipt of, vaccination that he has taken for the past 4 weeks, with an exemption of the yellow fever vaccination, because it needs at least 30 days to perform another vaccination. And then after that, we obtain informed consent from the patient or from of course, the parents of the patient. Okay, so we go ahead and discuss the risk of the disease, the benefit of the vaccination that we are going to administer, and then we are going to discuss as well some effects that the patient may feel right after the administration. Okay, and then of course, after we're done with the assessment, we are now ready to formulate our own nursing diagnosis. So for today, our nursing diagnosis is going to be ready for enhancement of knowledge status related to desire to enhance knowledge on extended program for immunization. So after that, we are now ready to go, or we are now ready to implement our planning. Now, for the planning, we just have to make sure that the mother has expresses her understanding in terms of the immunization recommendation. So now we are ready to do the intervention. So of course, for the first intervention, we get the medication, ensure that we've gotten the right medication from the refrigerator, check the expiry date, and at the same time, we've maintained a cold chain. Okay. And then after that, we prepare all the necessary equipment that we are going to use for the vaccination. So of course, we'll be needing the vaccine. Okay, we'll be needing a diluent, especially if we need to reconstitute. Obviously, it's not gonna be needed for pre-filled syringe already. We will be needing a 3 cc of syringe, a 19 gauge needle. Later on, that we're gonna be using for reconstitution or for drawing up. We will also be needing a 23 gauge 25 mm syringe for intramuscular injection, and at the same time, we are going to use a 25 gauge 16 mm of syringe for subcutaneous injection. Now, for injectable vaccines that do not need reconstitution, so in a vial, all you have to do is just remove the cap. So after removing the cap, we have to make sure that we maintain the sterility of the rubber bung. There's really no need for us to wipe the rubber bung with a cotton balls with an alcohol, especially if it's a single dose vial, and of course, especially if it's visibly clean. Okay, because it's visibly clean. And then after that, all we have to do is just to use our 19 gauge syringe, okay, to get the medication. So after getting the medication, we then change the needle before reconstituting it to the patient. Now, for injectable vaccines that need reconstitution, of course, we have to make sure that we reconstitute the medication or the vaccine as needed immediately before administration. So we'll be needing a 19-gauge syringe for drawing up. You'll also be needing a 23-gauge, 24 mm in length syringe, and this is for administration. And then make sure that we only use the supply diluent in your constitution. You do not use a sterile water, just the supply diluent. And then we make sure that we mix properly. We mix the vaccine properly, and then we reconstitute, or we make sure that we administer the medication immediately or as practicable right after administration or right after the reconstitution, because the vaccination will rapidly deteriorate. So how are we gonna do that? So let's see, for example, I've already drew up the diluent. Okay, so say for example this is going to be so after that, you make sure that we mix. After mixing it, we get the syringe. We draw the medication. So after that, we go ahead and change it before administration. So we are now ready to administer this to the patient. Now, for all injectable medications or vaccination, if we notice that if there's a large bubble on it, all we have to do is just to carefully expel the bubble, okay? Making sure, of course, that we don't prime. Okay, we don't prime the needle with the vaccination, because this will, or this for us to prevent the potential loss of vaccination due to the priming that we've done. Okay, so after that, we make sure as well that we don't mix local anesthesia with the vaccination or the medication that we are going to administer. Vaccination, of course, we make sure that we introduce ourselves to the patient, to the parents of the patient. We verify the patient's identity, and at the same time, we make sure that we explain the procedure. We explain the benefit of the vaccination, and at the same time, we also explain the possible effect of the vaccination afterwards. Okay, after that, we provide, or we do hand washing. So I've already done hand washing prior to me performing this procedure. And then after that, we make sure that we provide privacy to the patient. So say for example, if you're staying in a room, make sure that we close the door, or if you're staying in a ward, then we close the curtain. So after that, for IM injection, we'll be using a 23 gauge, 25 mm in length vaccination or syringe. Okay, so we position the limb of the patient, especially the site we are going to inject it, to make sure that, of course, the muscle is relaxed prior to us injecting. And then after that, after we position the patient, we make sure that we pierce the skin 90-degree angle, so as to, you know, safely inject the vaccine to the area. And after we've injected the vaccine, we make sure that we don't draw. It is necessary. It's not necessary for us to draw back from the syringe. We can just, we can just inject it right away. Okay, so that's how we are going to do the IM injection. So let's just pretend that this is the vastus lateralis of the patient, because this is made of plastic, so I really cannot inject it. So we are going to like pierce the skin, okay? Inject it at a 90-degree angle. Okay, and then inject. Okay, and then remove the injection. And then we just have to press it with a cotton ball, dry cotton ball, to stop the bleeding. So that's how we are going to do the IM injection. Now, for subcutaneous injection, we are going to do it, or we are going to administer the injection at a 45-degree angle on the skin of the patient. Okay, so in doing the subcutaneous injection, we are going to be needing a 25 or 26 gauge, 16 mm length syringe. Okay, so let's just pretend that this is that kind of vaccination or syringe. So this is how we're gonna do the subcutaneous injection. Sorry, so let's just pretend we clean the area. Okay, so 45-degree angle. And then we are going to administer the medication. And then we wipe it with the dry cotton balls. Now for the oral vaccine technique. So the liquid formation is basically presented in a clear liquid, okay, situated in a plastic squishable plastic, latex free, okay, latex free dose tubing with a twistable cup. So you just have to keep the cup because you may need that to pierce the tube. Now, the current dose of the patient, or the current oral dose of the patient, should be administered using an oral applicator inside the side of the cheek of the patient in a small dose. Okay, so if, say for example, a few minutes after you've administered the medication, and then the baby or the patient spat it out or vomited it, most of it, then it is definitely okay for you to repeat, okay, administering the same amount of medication. But if, say for example, the patient just regurgitate or vomited a small amount of the medication, then there's really no need for you to repeat providing or administering the oral medication. So basically, let's just pretend that this is an oral applicator. So all you have to do is just to administer it on the side of the patient's cheek, okay, and then do it in a small amount. Again, that's how you do it. Okay, so that's how you administer an oral vaccine or an oral medication. Now, for post-vaccination, of course, we are going to dispose all of our sharps, clinical and sharp waste into the waste bin, including any vials that we've used, and at the same time, any plastic squishable cup that we use for our medication. And then after that, after we've let's say injected, we make sure that we cover or we secure the injected part with an adhesive tape. So just say for example, this is the part that I've injected earlier on. After pressing it to make sure that the blood will stop, we then secure it with an adhesive tape. Okay, so after we've did the post-vaccination procedure, we make sure that we evaluate the patient for the next 15 minutes, monitor for any local reactions like pain, redness, or swelling. We also monitor for fever, monitor for any irritability or nodules on the injected site. And then we also document the vaccine that has been injected, including the type of vaccine, the brand, the batch number, the dose number. We also have to make sure that we've indicated the time and the date that the vaccine has been administered, the site of injection, and at the same time who vaccinated the patient. So basically, that's it for immunization. I hope you've learned something. And thank you so much for watching, and may you all have a great day. Thank you.